Welcome to Trinity Health IHA Medical Group Wednesday Wellness. Thanks for joining us this evening. So tonight's presentation is titled Navigating Your Overall Health, How to Get the Most Out of Your Doctor's Visits. And our presenting provider is family medicine physician Nora Dagher. Dr. Dagher practices out of our primary care location in Bloomfield. Welcome, Dr. Dagher.
Thank you, Allison. It's so good to be here for my first Wellness Wednesday presentation. Good evening, everyone out there. Yes, as Allison said, my name is Dr. Nora Dagher. I'm a family medicine physician at Trinity Health IHA Medical Group, Bloomfield campus, which is right on Woodward and Square Lake, close to St. Joe's, Oakland and Pontiac. So just a little bit about me. I'm a lifelong Michigander. I grew up in the Bloomfield, Birmingham area. I did my undergraduate studies at University of Michigan and then medical school at Michigan State. And then family medicine residency at Ascension Providence in Southfield, followed by a fellowship year in community medicine at the University of Michigan. So yeah, I've been with IHA since October 2022, and I love it. It's a great place to be. My colleagues are Dr. Miriam and Dr. Guma, if you've heard of them. So yeah, this is my presentation today on navigating your health, how to get the most out of your doctor's visits. All right, just a little disclaimer here. Always seek the advice of your primary care physician or other qualified health professional regarding your medical conditions, any specific goals you may have, or any other health-related questions pertaining to you. This presentation is for general advice only. So pretty much what we'll do is get into what a primary care physician is, the different types of primary care physicians, then we'll get into the specific visits you might experience, so like an annual visit, a new patient visit, and then maybe a sick visit. And then we'll also touch on some nutrition, physical activity, and mental health as well. Okay, so what is a primary care physician, or the acronym PCP? So they're basically the coordinator of your overall health. They're a doctor who helps you manage all aspects of your health. They're your partner, sharing the responsibility for your physical and mental well-being. They help you with prevention to stay healthy and also get better when you're sick. So they have to know a whole bunch of stuff throughout the whole range of medicine. They have a wide range of responsibilities, including your regular checkups that you get every year, diagnosing and treating illnesses, any injuries, and other health conditions in a non-emergency setting. It's proven that people with a PCP spend less time in the hospital and then less money on medical costs in the long run, so they are worth it. In addition to complete care over your lifespan, they can also decide whether you need more advanced care, so whether you need a specific surgery or you need to see a specialist. All right, so this is a slide on the different types of primary care physicians. They can be an MD or a DO physician, like myself, so they're pretty much the same. They do the same amount of medical school and residency. The only difference is a DO physician might get extra training in osteopathic manipulative medicine, which is basically similar to what a chiropractor or physical therapist may do. They get extra training in kind of muscle manipulation and putting your bones and muscles back into alignment. But otherwise, they're pretty much the same training. So you can have a family physician like myself or a family doctor. They see patients of all ages, sometimes even everyone in one family. So that's pretty cool. Pediatricians see primarily infants, children, and adolescents, as well as young adults between the ages of 18 and 21. Internists or internal medicine doctors will see only adults. And then geriatricians can be family medicine or internal medicine, and they focus on adults specifically age 65 and up. And then obstetrics and gynecology, or OBGYN as they're known, they see women only and they focus on pregnancy. And then part of your healthcare team can be a nurse practitioner or a physician assistant who also provide primary care. But the overall leader of that team is a primary care physician who has the overall responsibility. So yeah. Your PCP qualifications, I kind of went over that with my bio a little bit, but they do need 4 years of an undergraduate degree, your residency program in family medicine, pediatrics, or internal medicine, or extra year in surgery. Or they could also do a fellowship. So that's 1 to 2 years of extra training as well, like myself. So a lot of school. Some things to consider when choosing a PCP. You want to talk to people you trust. So that includes family members, friends, any neighbors. Maybe they have someone, they know you the best. So maybe they have someone that they think would go well with your personality. It also helps to ask other health professionals you know. So maybe you're close with a specialist or your dentist or anything like that. They may recommend someone. Make sure they're in network. So it's very important. Also consider if you prefer a male or a female physician. Consider location. That's huge. You don't want it to be a huge burden to get out to see your doctor if something comes up. You also want to know, how will you get in contact with them most often? What method do they prefer? When are they available? And how easy is it to get an appointment with them? And then how does their staff function? Are they friendly when you come into the office? Are they organized? Do they respond to you quickly? And then most importantly, is your PCP approachable? Do they listen? Do you trust their medical opinion? Because none of this matters if you don't trust their medical opinion. And so let's say you pick a doc that you like and you're headed for your new patient visit. So this is your establishing care visit. Some things that will be brought up and that you may want to know right away is your past medical history. This includes any chronic conditions such as high blood pressure, diabetes, or any time you had a major illness or hospitalization. Your doctor will want to know that. And then your current medications. This is very important. Make sure you know the name, dosage, how often you take this medication, and always have a list handy if it's a lengthy list of medications. So yeah, definitely recommend having a list. Past surgical history, you know, what surgeries have you had? Have you had a C-section? Have you had your appendix taken out? You know, these are all important to know. Any allergies, especially allergies to antibiotics, because it may come up that you will need an antibiotic. So this is important. Family history, I also like to know, usually in first degree relatives only. So keeping it to parents, siblings, maybe grandparents, sometimes an aunt or uncle. So this is all relevant to see what runs in the family. Social history is also very important. Are you a current or former smoker? You know, what's your work or home life? How is that balance for you? Do you work night shift? You know, what kinds of things do you do for a living? And then who was your previous PCP? Your new doctor will most often request a release of records to see what your previous doctors have done, you know, what your medical history looks like. So you'll definitely be filling out some forms when you come in. And then lastly, they'll ask you any concerns today you'd like to talk about. Most often than not, a patient will have some concerns they want to bring up because it's a new doctor. But you get those rare patients that really have nothing to talk about and they just want to establish care. So sometimes we'll turn that into a physical. And then that leads me to the next visit, the annual exam. This is your yearly checkup. Typically, this is a comprehensive health visit that happens once a year. And includes reviewing labs. So usually I ask patients to do their labs before their appointment. And I want them to be fasting when they get their labs done. So some things we'll go over are cholesterol level, their electrolytes, like their sodium, potassium, their sugar, what that looks like. We'll go through their kidney function, their thyroid function, their liver function, look at their blood count, make sure there's no evidence of infection or anemia. And then what does their vitamin D look like? Here in Michigan, we are chronically low on vitamin D, so I see that a lot. Also, after we're done reviewing the labs, we'll go into relevant cancer screenings. So I'll ask women, you know, if they're up to date on their pap smear, mammogram, and I'll look and see when that last was. And I'll order that or schedule that if that has to be done. And then also, if you're 45 and above, I'll ask about colonoscopy. You know, there's bone density screening if you're a woman who's 65 and above. So there's a variety of different cancer screenings that we talk about depending on your age. And then I'll bring up medications. So we'll make sure that's up to date. The list is up to date in the chart, and I'll ask if there's any refills that are needed. Immunizations is also really important. With this kind of winter we're having, I'll ask if your COVID and flu shot are up to date, as well as tetanus sometimes. So this definitely comes up. And then I like to do a depression and anxiety screening. So we'll get into this a little bit later in the presentation, but there's two main screening tools that I use. There's a PHQ-9 for depression and then a GAD-7 for anxiety. So I like to see where you're at when you come in for your physical. And then the most important thing, an overall lifestyle review. So what do your eating habits look like? What about your physical activity? How does this fit in with your overall work schedule? And what are some attainable goals for you? Are you a smoker, any alcohol, any illicit drug use? And then I'll update you on your eye doctor and dentist and make sure you check in with them. And then, after all of that, I'll ask if the patient has any concerns today. And I usually try to limit it to 1 to 2 issues because we got a lot to get through in the annual. So sometimes if a patient has a lot they want to talk about, I might ask if they want to move the annual to a different day and just focus on issues for that day. So it's kind of patient dependent. And doctor dependent on how many concerns you get to bring up during your physical. And then after all this, I'll do a full head to toe exam. So make sure to look at the back of the throat, the ears, the eyes, heart and lungs. We always listen to and listen to your belly, and then make sure there's no swelling in your legs and stuff like that. And then I'll ask if there's any abnormal skin, moles or anything that you'd want me to check out and stuff like that. So it's a pretty comprehensive visit with a lot to get through, but very important to get this done every year. And then I did mention that we go through lifestyle questions during the physical exam. So just presenting some general information about nutrition that I try to get across to all my patients when they come in for their annual. So it's important to know that everyone has a different caloric need based on their age, their sex, their health conditions, and their activity level. And by all means, one size does not fit all. So think about what are your specific goals for healthy eating. So I always ask patients, like, given your lifestyle and everything you have going on, what's something that's attainable for you? Because I can sit and talk all day about what's healthy, but if it doesn't fit in with your lifestyle and your culture, then it's just not going to get done. I tell patients to pick foods that they like that are high in nutrients, matching their personal preferences, what they like to eat, their cultural traditions, and of course their budget. And I just included this little blurb on if you have trouble finding healthy food in your community, there is a tool called the Neighborhood Navigator, and I have the link down there. So pretty much it's a tool that allows you to look for free resources in your community. So you just put in your zip code on the screen. So I put in the zip code for my clinic, 48302 in Bloomfield, and it gives you a whole list of different programs, food, housing, health, education, anything you could want. And then I just picked something arbitrary, like under food, I just picked community gardens just to see what was out there. And then this is what it had a whole list, but I just screenshotted a few things. So some community gardens, and I believe St. Joe's Trinity Pontiac has a community garden as well for the people who live in the area, but it kind of shows you where they're located, next steps, a number to call, when they're open, and it just has a variety of resources if you're somebody who needs that. And so going back into the nutrition, I tell patients to choose whole fruits and vegetables. They can be frozen or fresh, depending on what you can get. I recommend whole grains, so whole grain bread instead of white bread, whole grain pasta instead of the regular pasta. I recommend brown rice instead of white rice, and then sweet potato instead of regular potato. So any kind of carb that gives you more bang for your buck nutritionally. I also recommend lean proteins, so fish, turkey, chicken, lean beef, and of course plant-based oils, so olive oil. There's also peanut oil and avocado oil and stuff like that. So those are on the healthier side to cook with. And I tell patients most of your plate should be fruits and vegetables and lean proteins, and really think of carbohydrates as a side portion of the meal. So I like a plate of pasta myself, but we can't always have that. Carbs shouldn't be the main portion, just focusing on the vegetables and the protein primarily. And I tell people to limit alcohol and sugary drinks, and limit eating out to 1 to 2 times per week. So when you meal prep at home, when you cook at home, you can control the kind of butter and salt and cooking method that goes into what you're eating. So that's really important. And then healthy cooking methods, right? I tell people, baking, steaming, grilling, or an air fryer is better than frying with oil. And then desserts in moderation. I have a sweet tooth myself, but I try to stay in moderation with that. So on the weekends, on occasion, it just can't be an everyday thing. Or if it is, maybe a small piece of chocolate or something to satisfy that craving. And then making sure to stay hydrated. So I tell people to try to hit 2 liters of water a day, stick with water and fruit and low sugar or non-sugar beverages, and cutting out the juice and the pop and the frappuccinos and stuff. That can really help with weight maintenance as well and overall health. And healthy snacking. This is a big thing that comes up. So snacks are really a great addition to a healthy diet, but it's something to consider. If you're find yourself snacking more often, ask yourself, are you getting enough to eat during meal times? So it may be that you're not eating enough during your meals, or you're not getting enough protein or something like that. So when you do snack, make sure you choose snacks that are high in fiber or protein that can help keep you full for longer and give you more nutrition. So cravings are okay. For example, I tell people, if you have a craving for chips, try to put some chips in a bowl instead of eating them out of the bag, and really pair them with a piece of fruit or some string cheese so that you feel full for longer, and it's more of a satisfying snack, and it goes a longer way. And then physical activity, just something I like to say during my physicals as well. The American College of Sports Medicine recommends that all healthy adults aged 18 to 65 should participate in moderate intensity aerobic physical activity for a minimum of 30 minutes, 5 days out of the week. So I tell patients, don't be overwhelmed by this. This is the overall goal, but if you can just get in to do something physically active 2 times out of the week, that's great too. So anything works. It's better than nothing. So or what's recommended is vigorous intensity aerobic physical activity for a minimum of 20 minutes, 3 days out of the week. So also, the American College of Sports Medicine recommends muscle strengthening activities on 2 or more days a week that works all major muscle groups. So some examples of this are on the moderate intensity aerobic activity side. You can do brisk walking for 30 minutes, 5 days out of the week. So if you have a dog that you walk, or maybe you joined a gym like Planet Fitness, and you can do like a treadmill or elliptical for 30 minutes, 5 days out of the week. Maybe join a dance class, or you do something from your home on YouTube. Those are all options. And try to incorporate muscle strengthening as well, 2 or more days out of the week. So major muscle groups like chest, abdomen, legs, arms. So if you have like 5-pound weights at home, you can come up with a set of muscle building activities that you do as well. And then when we think about vigorous intensity aerobic activity, we're thinking about jogging or running for 75 minutes spread out over the week. So that's people who, consistently jog or run marathons or something like that. And also including the muscle strengthening activities as well, 2 or more days out of the week, working those major muscle groups. So from that, just touching on the mental health aspect of everything, these are the 2 screening tools that I like to use in the physical. So on the left, we have the PHQ-9. This is our depression screening tool, and it asks questions from 1 to 10, and it helps screen where you are on the depression scale. So it ranks the responses in a mild, moderate, or severe category. On the right, we have the GAD-7. This is the anxiety screening tool. It asks questions 1 through 7, and then also categorizes your responses in a mild, moderate to severe category. And both of these tools focus on the last 2 weeks, and they kind of ask you questions pertaining to how you're feeling in the last 2 weeks. For example, the depression screening tool asks if you have little interest or pleasure in doing things, whether you feel down, depressed, or hopeless, feel tired or have little energy. So it goes through all of that. And the anxiety screening tool will ask you, do you feel nervous, anxious, or on edge? Do you have trouble relaxing, becoming easily annoyed or irritable? So by no means do these 2 things, are they meant to categorize you or like say that you have something and diagnose you, but they're just a way for your doctor to bridge that conversation and to open that up and just see where you're at. So they are helpful in that sense. And from there, depending on where you score, I like to tell patients about finding a therapist. So I always say that everybody should have a therapist and a primary care physician, because everybody will have a time in their life when they just need to talk to someone. And this is a really good tool on psychologytoday.com that allows you to find a therapist in your area. So it's another tool where you can just put your zip code in. So I did that for our clinic. I put that in and it comes up with a list of different therapists who you can filter based on insurance, whether you prefer a certain gender, prefer a certain type of therapy, like what they focus on, like panic attacks or anxiety. So you could filter it however you like and look at the list. Trinity Health, IHA Medical Group, also has a collaborative care behavioral health program. So they will work with patients who have anxiety, depression, or both. And it's available at several IHA locations. So at our office in Bloomfield, we do have a really great behavioral health specialist. Her name is Lindsay. She works with myself and the primary care physicians, as well as a psychiatrist. So she'll give recommendations and she'll through the psychiatrist, and she'll also see patients every week, and she has a virtual option. So she's a really great resource. So yeah, definitely ask your PCP about a referral to a behavioral health specialist if you feel like you need it. And then when it comes to medications, maybe therapy isn't enough for some people. They may be in the stage, moderate or severe stage, where they would like a medication to help with depression and anxiety. So it really depends on how it's impacting your day-to-day functioning. That'll depend on whether or not you start a medication. But typically, you need to give it time to see the full effect. So you take these medications once daily for about 4 to 6 weeks and let them build up in your system, and then you'll see their full effect. They can be there for a short-term or a long-term treatment, really depending on your needs and what's going on in your life. And then if you're someone who experiences panic attacks, your doctor may give you something quicker acting to use as needed. But in my experience and from what I've studied, I've seen that medication plus talk therapy gives you the best outcome when you're dealing with depression and anxiety. And then, moving on from all the preventative stuff, other visits you may have with your PCP include sick visits, as well as chronic conditions follow-ups. So when you have a visit like this, where you have a concern and you're focusing on that, it really helps to make a list of your concerns before you go in. Because I've had so many patients, ask a bunch of questions, and then as soon as my hand touches the door, they're like, oh, by the way, this and this. So it really, or people will call me after and say, I forgot about this. So it really helps to make a list if you feel like you have multiple things you want to talk about. Keep in mind, your doctor may limit you to 2 or 3 concerns, really depending on how lengthy and how involved your issues are. And they may request you schedule a follow-up visit, but it doesn't hurt to bring in a list. And then be ready to answer the following questions. So if you're coming in with a specific concern, your doctor will ask you, when did it start? Is this constant, or does it come and go? How long does it last? What makes it better or worse? Any associated symptoms with it? Has this happened before? And if so, what worked? Because that's helpful. And then if you're in pain, they may ask you to describe your pain. Is it sharp, achy, dull? What does it feel like? And then what things have you tried? That's always helpful to know. And then a good doctor will make sure all of this is clear, but this is just my advice. Make sure you leave feeling clear about what you have to do and when to follow up. And it's okay to ask your doctor to slow down and ask for clarification if you don't fully understand what was explained, because a lot of medical conditions can be complicated. And if your doctor suggests something over the counter, ask for a picture of it or have them write it down for you if you know you're someone who'll forget, or if you've never heard of it before. If your doctor prescribes a new medication, make sure you know what it's for, any major side effects, how often you should be taking it, and for how long. Some things are short-term, some things are long-term, maybe your entire lifetime, so it's helpful to know. And then ask if you should be doing any at-home monitoring. For diabetics, we want them to check their blood sugar maybe twice a day, fasting, and then after they eat. For people with high blood pressure, we may want them to check their blood pressure a few times out of the week and record it. So just ask if you should be doing anything like that. And then also ask if there are any lifestyle changes you can do to help. Um, and then you also want to know, okay, if this gets worse, what does an emergency look like? You know, when should I go to the ER? When should I be concerned? Okay, in conclusion, that was my talk about navigating the healthcare system and really utilizing your primary care physician. And I hope that you all found it helpful. And yeah, thank you for having me. And I am ready to take questions. And then my information is on here. So
Yes, fantastic. So as Dr. Dagher said, her information is listed here. You can also visit ihacares.com if Bloomfield is not an area that's close to you. I know we are speaking to patients throughout the whole region. So you can visit ihacares.com and there'll be a list of primary care practices throughout the region. So you can find someone closer to you if needed. So we do have a few questions. I'm going to jump right in, Dr. Dagher, if that works for you.
sure, sounds good.
Okay. So it looks like some people maybe missed your explanation,
Sure.
DO versus MD. So,
Yeah,
and this person is looking specifically for a difference in the base philosophy. Does that make
sure.
sense to you?
Yes, that makes sense.
Right.
So yeah, DO versus MD. Two different types of physicians you could see in the United States and around the world. Both have the same medical school training requirements. So they will go through the same courses: anatomy, physiology, cardiology, neurology, so all the major organ systems. The only difference is a DO physician gets extra training in what's called osteopathic manipulative medicine, or OMM, or sometimes OMT. All that is focusing on the major muscle groups and bones and how they align together and how to manipulate them and really relax any like muscle spasm or like rib that's out of place, or just put the body back into alignment. So they get extra training on that, and it's a type of it's just another tool in their toolkit that they can use if someone is having any musculoskeletal complaints. So I really enjoyed the training on that. So that's something that I can do for patients. And then a difference in base philosophy, I think the difference is that DOs try to present themselves and the school tries to present themselves as more holistic, but I think you can find holistic DOs and MDs alike. I don't think it's limited to just DOs. And I think there are good and bad doctors everywhere. And really, I think that an MD can be holistic just as a DO can, but we do have that extra training in the OMT. So yeah.
Okay, perfect. That kind of leads me into the next question of many people maybe are used to seeing their PCP or their primary care physician
Yes.
annually, like once a year, maybe a few
Mhm.
sick visits thrown in there. So when you're talking about some of those manipulations or managing a chronic condition, will you schedule patients for more frequent appointments as needed?
Yes, so definitely, if someone has a chronic condition that we're actively managing, like diabetes, for example, and their sugar is out of control, I may definitely bring somebody in sooner than their annual physical or future appointment. So sometimes, we like to do diabetes check-ins every 3 months. We'll like to do an A1C check-in. If you're stable, we might push it out to 6 months. And then if someone has a high blood pressure, and they just started a new medication, I might want to see how it works. So I might bring them back in 2 to 3 weeks. It all depends on the chronic condition and is it controlled versus uncontrolled. So yeah, I will definitely bring patients back sooner.
Perfect. And in maybe in between appointments, or maybe an appointment might not be necessary if they can
Mhm.
ask a couple questions through my chart. Does that work for you as well?
Yeah, that works for me. It really depends. Some people, like going back to the blood pressure kind of thing, I have some patients that live pretty far. So I'll just ask them to, if we know they have a working blood pressure cuff, I'll ask them to just report their readings via my chart, and we can kind of see what their readings look like. And if they're super high, I might ask them to do like a video visit or something like that. So yeah, if you have a working blood pressure cuff, Sometimes if you have a glucometer, like where you can check your blood sugars as well, if you're diabetic, your doctor may allow you to do a virtual visit or just report readings through my chart. So yeah, sometimes I'll do that. It really depends on the patient and their situation.
Okay, perfect. Um, so as a family physician, you see patients, literally the entire family, from
Mhm.
newborns to grandparents, right? Or great grandparents. So how much training is there in handling those elderly patients? And specifically, this person is looking for someone who has dietary issues as a senior.
As a senior, yeah.
Mhm.
That's a great question. I think we all family physicians get training in geriatrics. So we do have a nursing home requirement in our training where we go to a nursing home, regularly and see regular patients there. We also frequently see patients 65 and older. So there is, at least in my program, there was a lot of exposure to elderly patients. We did a hospice palliative care rotation as well. um, so most PCPs are familiar with elderly dementia patients. If you have somebody with specific needs, um, then a geriatrician might be a really good idea because they not only completed a family medicine or internal medicine residency, but they went into a year or two extra of fellowship training in geriatrics. So that might be your best bet as well. So, but any family, internal, or uh, PCP will have training in elderly dementia patients.
Okay, perfect. Let's see. So when it comes to depression, if
Mhm.
this is something new you're feeling, is it best to go to your PCP or should you try to locate a therapist on your own?
I would say talk to your PCP about it first thing. If you have a good rapport with your PCP, if you're established with someone, definitely let them know how you're feeling, and they can make suggestions maybe you haven't thought of. And they can point you in the right direction for a therapist. So yeah, I would always start with your PCP.
Okay, perfect. It really seems like your PCP is kind of your first step. I know
Yeah.
personally it is for me, for sure,
Yeah,
regardless
yeah.
of the issue.
Yeah, for sure.
So when you're working with your patients who are looking to get exercise recommendations, do you have different recommendations for people who are 65 and older? And so like a number of minutes per week, certain muscle building, would you
That's a
direct
great
them? Yeah, go ahead.
Yeah, that's a great question. Definitely, those recommendations change when someone's 65 and older, kind of depending on their mobility and their health conditions and stuff. So I do handle that on a case by case basis. But for the most part, I'll definitely encourage light aerobic activity and muscle building 2 times out of the week as well. So um, I always, especially in my patients who have thinning bones and osteoporosis, I'll recommend the first line treatment is weight bearing exercise. So we'll definitely recommend getting 5 pound weights if they can handle it and incorporating some sort of muscle building exercise 2 times out of the week. So highly recommend. And then I just encourage the elderly if they can to walk, in their neighborhood with family, with friends, and just make it part of a social healthy activity. So yeah, all of these safe physical activity things that they do can help reduce the risk of falling and can help strengthen bones and improve quality of life. So yeah, definitely.
Perfect. Okay. So when it comes to your PCP,
Mhm.
what if they give you an opinion that maybe differs from a
Mhm.
recent medical journal article you've read or something
Okay.
that maybe you hear on the news?
Yeah, that's a great question. There's so much information out there. It's always helpful to bring the journal article in. Maybe it's something your PCP hasn't seen before, if it's pretty recent. I know that's happened to me sometimes. You can't keep up with, there's so much information, it's hard to keep up with. So if you find something from a reputable medical journal and it's differing from something your PCP is saying, it always helps to bring it in. Um, and I think a reasonable PCP will work with you and they will kind of um, bring in their own expertise along with the latest updates and then your specific condition, and then it's their job to find a good happy medium that works. So yeah, I would say always bring information that you find from reputable sources.
Great. And that's a great thing to remember that, you can get into the conversation with your primary care physician. That's
Yeah.
a good reminder not to be afraid to do that.
Yeah, for sure.
This is something I've noticed personally as well. So when you have a condition that maybe means you need to visit the ER or you need to be hospitalized, your primary care physician isn't necessarily going to round
Right.
like we traditionally maybe would think about. Can you talk a little bit about what a patient could expect when they have to be admitted to a hospital and how the
So
primary care physician will engage with
sure.
them?
Yeah, that's a great question too. There are some primary care physicians out there that not only will see you in clinic, but then they'll also round on you if you get admitted to the hospital. So those are great physicians. I've worked with them. It's a super challenging thing to do. So not a lot of doctors do that, but you will find some ones that do. But for the most part, at least for me and my patients, I don't follow them in the hospital when they get admitted. So they'll go to the ER, they'll see the ER physician, and then they'll get admitted to a specific hospitalist, internal medicine doctor who rounds on patients in the hospital. And then when that patient, so they're under that hospitalist care during their stay in the hospital, and then when they get discharged, that hospitalist will send me a discharge summary of everything that happened during the hospitalization. It's a super detailed note with all of the information and basically a whole essay on your time in the hospital. And then you come see me or your PCP in the office for what's called a transition of care appointment from the hospital. And you have to see your doc in 7 to 14 days from when you get discharged. And they go over everything, like a PCP would go over everything that happened with you in the hospital and like help refill your meds, update your med list, and refer you to the necessary specialists, make sure you have everything you need at home. So yeah, those can be quite challenging visits, but they're extremely important. And yeah, I get a report, or your PCP will get a report from the hospitalist. So yeah, that's what happens.
Okay, great. Um, and So I wanted to talk about, I'm sorry, I'm skipping around here. One
It's okay.
second. So if you could talk a little bit about what an appointment with your PCP is like now in the world of COVID. So
Oh
this
wow.
person, it looks like they had kind of a complication because they had a cough and there
Yeah.
was some hesitation about having them come into an
Oh,
office.
okay.
So I just wonder if you can kind of talk a little bit about that situation if a patient is sick, what happens?
Yeah. I think initially during COVID, um, what happened when we didn't know much about it back in 2020 and even 2021, um, what doctors' offices would do was if you had a cough and they couldn't verify if it was COVID or not, and testing wasn't as readily available, they would do a virtual appointment and then see you virtually via telehealth or something like that. Um, I think now, at least at my office, we'll see anyone with any kind of symptom, and then we just wear our mask and go in and see them, and we can test them right then and there. So yeah, I think it differs office to office on policy. Yeah, I'm trying to read this question here. Yeah,
Yeah.
it differs on policy. So there isn't a norm. I think there isn't like a norm for everybody. It's kind of clinic dependent. But I know in our office we see everyone in person now. So unless you request a telehealth visit or something.
Okay, so if you are feeling sick, but you need to be seen, you can make your way in, or if you're not feeling like coming in, you're able to actually meet with your primary care physician virtually.
Yeah. So what COVID did do is make virtual appointments more mainstream. So those are definitely not going away. They're going to be around for a while.
Yes, definitely. I think we're
Yeah.
all kind of used to Zoom as
Yeah.
we sit here on a Zoom
Oh
presentation.
yeah.
Um, can you talk a little bit about fibromyalgia? Is that something that you
Sure.
treat or that you work with?
That is something I work with. That is a condition that's pretty multifactorial. It involves muscle pain, it involves trouble sleeping, it involves depression, and there's many different medications and ways that we can treat it. Usually, sometimes involves a specialist, sometimes doesn't. But yeah, I have treated fibromyalgia before.
Okay. And can you talk a little bit about how much time an average office visit should take?
Good question. It really depends on the visit. I know annual physicals can take anywhere from 30 to 40 minutes. I think it used to be 40, but now they're cutting it down to 30. But yeah, 40 minutes max. A post-hospital visit can take 40 minutes, and then a typical sick visit will take about 20 minutes. So those are a new patient visit is probably 30 minutes. So that's kind of how they allocate the time.
Okay, perfect. And what about second opinions? Is your primary care physician someone who can look at a report for something such as a cancer diagnosis? Or can they help you find someone to give a second opinion?
Yes, definitely. So, if you got a diagnosis from a specialist, and you bring it to your primary care doctor, maybe they'll definitely help you understand what is going on. And if you request a second opinion, they can definitely refer you to somebody new to take a look as well. So yeah, that's definitely a good place to take your new diagnosis that you're not sure.
Great. And there are a couple questions around insurance, it looks like, and
Yeah.
maybe Medicare.
Okay.
This person is wondering, do Medicare patients receive the same level of care that you've outlined?
Yes.
Okay,
They do.
perfect. And
Their
no,
physical might be called a Medicare wellness visit, and that includes more components than what I listed. So if anything, they have a more lengthy annual physical. But yeah, sometimes that involves like talking about your activities of daily living, that involves like a memory test and a mobility test and screening for dementia and stuff like that. So yeah, Medicare physical involves everything and then some.
okay, and if a person is wondering if a specific physician or practice accepts their insurance,
Mhm.
do you recommend that they start with a phone call? I know we list insurance, I think in my chart, maybe it's listed, and then on our website typically, but is a phone call to the practice a good
Yeah.
first step?
Yeah, that's a great first step.
Okay.
Yeah, a phone call to the practice, if it's listed on their website, all of that is a great first step.
Okay. There are a couple people asking about different conditions. So,
Mhm.
one person is a female and she's in her
Mhm.
mid 40s with no health issues. She's wondering how frequent should she be having those annual physicals?
No, no medical conditions in her mid 40s. Okay.
Mhm.
Def Once a year, for
Okay.
sure, once a year.
Okay. And how about lab tests for someone who's over 65? Would you order specific lab tests for them each year or annually?
Someone over 65, I would probably um get the same tests as long as they're covered by insurance.
Okay.
Sometimes Medicare doesn't cover certain things for certain reasons. So, but baseline, I will check kidney function, liver function, electrolytes. I will check cholesterol and sugar, and I will and thyroid. So I will definitely do that every year.
Okay. It's good to know what to expect from that angle. How about smoking since cessation? So this person is actually asking specifically, is there a good way to handle a patient that continues to smoke
Mhm.
when it's really the worst thing they could be doing for another disease that they currently have? How do you work with people that are either trying to stop smoking or maybe need to stop
Mhm.
smoking?
Oh yeah, great question. That is one of the most difficult things primary care providers and all doctors deal with. You have a patient that's actively doing something that's hurting their chronic condition or making it worse. And how do you bring that up? Especially if the patient may feel that it's not a big deal. Um, Definitely, this is an art. So you want to ask the patient like, how long has this been going on and how do you feel about it? What are good things about smoking? What are bad things about smoking? How does it fit into your life? Is this a stress reliever for you? And there's many different ways to approach it. If smoking is a stress reliever, maybe there's untreated anxiety and depression you want to look into. Maybe smoking has been a source of comfort and it's just developed into a habit. Maybe all their friends and colleagues at work smoke, and so that they are comfortable to smoke. So there's really many aspects, but there's definitely screening tools. Like if someone's a heavy smoker and they're aged 50 above 50 years old, and they've been smoking for like a pack a day for like 20 years, you can do lung cancer screenings on them every year if they fit certain criteria. So that kind of, and every time you see them, you want to bring it up like, hey, how's the smoking going? How's the quitting smoking going? How do you feel about it? Anything change? It's definitely something that's not achieved in one visit. You gotta not only establish a good relationship with the patient, but you gotta bring it up every time they see them and kind of get annoying about it. And then, pretty soon there's going to be something where the patient's going to be like, look, I'm sick of this. This is expensive. This is bad for me. I hate the smell. Their patients will come to that conclusion, but you really got to work with them. That's a long game right there. You got to be patient.
Yeah, definitely.
Mhm.
Somebody wanted to know, can you mention a few of the symptoms that might prompt you to do a thyroid check?
It's a good question. Yeah. Prompting me to do a thyroid check, I would ask, do you feel cold all the time or hot all the time? Like extremes in temperature. And I'll ask like not only feeling cold in the winter, but do you also feel cold in the summer? So difficulty regulating temperature is one. Difficulty with weight maintenance. Either it's super hard for you to lose weight or super hard for you to gain weight. For women, I'll ask if their menstrual cycle is off or spotty. You can ask about constipation if somebody's has chronic constipation or chronic diarrhea, or you can ask, if someone's having like irregularities in their heart rhythm. All of these are reasons to check a thyroid. Yeah, there's many different reasons to check a thyroid. It can do a lot of things.
Yeah, yeah,
It
it is. It's a sneaky little gland.
is.
So will you manage the thyroid medication if that is needed, or will you recommend they see an endocrinologist or another specialist?
Yeah, good question. I think I most of the time manage thyroid medication and I don't have a problem with it if they are hypothyroid. So if they have low thyroid hormone, I will manage the thyroid medication. If someone is hyperthyroid, they have too much thyroid hormone, I will send them to an endocrinologist because they may need more extensive monitoring, or they may need removal of the thyroid, depending on, what's the reason they have an overactive thyroid. So yeah, I can do basic thyroid things and manage most thyroid conditions, but there are some that I will refer out for. It really depends.
Okay, great. So this person is asking, um, do you have any opinions on medication for osteoporosis? And do you ever work with patients who maybe are seeking holistic alternatives to medication?
Um, yeah, I will definitely work with patients seeking holistic alternatives to medication. However, if I know of a medication that's very good and can treat a condition, I will promote that as the primary solution, and then alternative modalities I will totally welcome as a supplement. So that's pretty much my approach. I don't shy away from it. I really welcome it, but I will also promote what I know to be the best treatment based on my training. And then what was the other part? Medications for osteoporosis.
Yes.
Yes, there are a variety of medications for osteoporosis. I think number one is alendronate. That's the number one, or that's one of the main medications that they'll promote first. And there's also Prolia. There's many different kinds of medications, but alendronate will be the first one that PCPs kind of go to.
Okay, sounds good.
Yeah, there's many different ones.
That's pretty good off
Yeah,
the top of your head.
yeah.
Do you have a source that you like to recommend to your patients for medical research?
Yeah, that's a good question. I recommend reading the CDC recommendations. I recommend reading Cleveland Clinic, Johns Hopkins, U of M. I get a lot of my resources through them. So yeah, those are the main ones I'll recommend.
Okay, that sounds good. So, and again, like you said, if you have an article or you saw something, to bring it in and cite it, and then your PCP can kind of help you decide whether or not that's really a reliable source.
Yeah, for sure. And they can help talk through it with you and explain their reasoning. And then if they've read the article, they can tell you what they think, or if they haven't, they'll definitely catch up on it. Maybe they may say, let me read this and then get back to you. I've had that happen a few times. So yeah, definitely bring it to your PCP if it's something that you're concerned about.
Okay. A couple people are asking for the Neighborhood Navigator site. It was called Neighborhood Navigator, correct?
Yes.
And we will include that link in the follow-up email. So you don't have to jot it down tonight. You will receive it in a day or two, when the email arrives.
Mhm.
What do you think about biking for physical activity?
It's great. Biking is great.
Okay. Is there ever a situation where you might recommend somebody not try biking?
I think if you have bad knees and it hurts your knees, then you might want to consider something like the elliptical or something like that. It's a little bit easier on the knees than biking and treadmill. But yeah, if you can tolerate biking and you're not in pain, then by all means, it's a great physical activity.
Okay, maybe not in this weather, but
Yeah,
hopefully
not
soon.
this.
Hopefully
Yeah.
soon. Um, let's talk about weight loss a little bit.
Mhm.
So it looks like this person is asking, they've tried for multiple years to lose weight and just seem to always gain it back. Will
Mhm.
you talk through that journey with your patients and maybe talk to them when it's time, when they're at a point where they could consider surgery?
Oh yeah, this is something I do all the time. Um, if somebody has been through a lot of different weight loss treatments and they've tried everything and they're very frustrated, we have a nutritionist in our office, so I'll make sure that our patients are acquainted with the nutritionist as well and really optimize everything going on in their life. And then I'll talk to them about two options. I've talked to patients about starting a medication for weight loss, and I've also talked to them about going the surgical route. So first things first, just making sure that you're somebody who insurance would pay for that. And then yeah, I will definitely talk about it with them. It's one of the options if you fit the criteria.
That's excellent. And it's so
Yeah.
great to know that there's yet another resource for nutrition
Yeah.
located right in your primary care provider's office.
Yes, there is. Yeah.
How about pap smears required at 70 and above? Do you have a recommendation?
So what I know to be true is a pap smear starts at age 21 and stops typically at age 65. So if you are somebody that has a gynecologic cancer in your history, they may want to do pap smears more frequently after 65. But for average risk adults who've had normal paps throughout their life, it usually stops at 65.
Okay. Um, how about this person is asking about any concern with arsenic levels in brown rice?
Yeah, I did see that
Okay.
that question. I would say that with anything, you want to be moderate in your intake. So definitely wouldn't recommend eating like large amounts of anything. So if it's just like a supplemental part of a dinner, then that's no problem.
Okay. And is there a calcium score recommended for a heart diagnostics, for heart diagnostics? I
Okay.
tripped over that a little bit. So
Yeah.
is calcium score recommended for heart
Oh, okay.
diagnostics?
Got it. Got it. So I believe they're talking about the coronary calcium score to determine if you have plaques on your arteries. And that sometimes I have not seen that covered by insurance, so you'd have to pay out of pocket, but it's a great option if you're somebody that really wants to know what's going on in your major arteries. And if you have to be on a cholesterol lowering medication long term, I've had patients that really don't want to be on a cholesterol medication and they're kind of on that border. And so they really want to know what's going on in their body. So they'll pay for the coronary calcium score, like maybe $75 to $100, and they'll get it done. And then, yeah, I'll get the results. And sometimes it's 0% plaque. So I'll be like, okay, you don't need to be on a cholesterol medication. So we'll recheck in like 5 years. um, that's something that happened to my dad because he really didn't want to be on a cholesterol medication. So that's definitely an option. You can ask your doctor about that if you're willing to pay out of pocket. Sometimes insurance doesn't cover it.
Okay, that's
Yeah.
good to know. What about, do you have an opinion on estrogen therapy after menopause? Do you prescribe Premarin patches?
So typically I don't do estrogen therapy after menopause. That might be an OB-GYN question for them, but I have prescribed Premarin cream before um for like vaginal dryness or something that a specific issue that a woman's going through, but I typically do not do estrogen therapy after menopause. It's a good question.
Okay. This person is asking, what would you say to your patients that are concerned about side effects of osteoporosis medications?
Um, I would, just like any other medication, I have a risk benefit discussion with patients. So I'll talk about, this is your condition and this is the risk of it going untreated. And then this is the medication that we know works well. And these are the side effects. Um, if the side effects are pretty minimal and you know, um, they're and there's a risk in having your condition go untreated, like osteoporosis. The major risk is a fall and breaking your hip. So that has a lot of side effects as well to it. So having your osteoporosis go untreated has side effects as well as the medication that treats it. So it's really a risk benefit discussion. I would say that the risks are higher of letting your osteoporosis go untreated. So it's worth trying a medication and seeing how it goes. And you can always stop it and try something else.
Perfect. This person is asking, do you have a recommendation for the best way to get the correct amount of daily fiber from food?
Yeah, that's a good question. It's hard to do sometimes. So the best way to get the correct amount of daily fiber, I would say, is just focus on incorporating high fiber foods into your diet. So I tell patients, that's oatmeal in the morning. That's like incorporating more dark leafy greens and different variety of vegetables and fruits throughout the day. Then it's drinking plenty of water because you can eat all the fiber you want, but if you don't flush it with some water, then it just kind of sits there and makes you feel uncomfortable. There's also beans, that's a really good fiber source as well. And then if people struggle to get fiber in their diet, there's also the option of doing Metamucil every morning in their water, in a glass of water, and just drinking that, and doing a fiber supplement every day. So yeah, if you can't get it from your food, which is the best way to get it, then fiber supplement works too.
Okay. It looks like this person is asking about the WHO recommendation. So the World Health Organization recommendations regarding obesity as a disorder. Do you want to talk a little bit about how maybe you would classify obesity?
Yeah, great question. I keep saying that for everything, but these are just really great
They are really
questions.
great. Yeah.
They're really great.
Sure.
Okay, so the WHO recommendation of classifying obesity. So yeah, there's many different ways of classifying obesity. So the way I look at it is I know it's a tool that's not the best tool, but the BMI helps physicians and healthcare providers classify obesity at this time. And obviously, like, it's just one number, but I also take into account everything that the patient has going on. So I like to know, what's their BMI? Is it above 30? Is it 30 or above, or which puts them in the obese category, or is it 27 to 29, which is overweight? But do they have, conditions based on their weight? Like, do they have high blood pressure, diabetes? So there's different categories, but usually obesity is classified as a BMI of 30 and above. And then overweight is a BMI of 27 to 29, I believe. Yeah. So those are the criteria we use, that doctors use, but they take into account everything else. That's just like a hard and fast number that insurance uses to classify and cover certain things. So that's what we use.
Okay. Oh, we have another question on, it looks like the osteoporosis category. So
Big category.
it is, it's a
Yeah.
popular one. Do you suggest a follow-up? I might trip over this a bit, so bear with me. Do you suggest
Uh-huh.
a follow-up DEXA scan after a year
Uh-huh.
longer on Prolia, to see if medication is effective in strengthening those bones?
That's a great question. I think I usually check DEXA scans every 2 years. So I believe 2 years is sufficient. But if I have a patient who's really interested and for their peace of mind wants to know how the medication is going, then I will definitely get a DEXA scan sooner if that's something that I decide on with the patient. But I typically do it every 2 years.
Okay. And it looks like there are a couple questions on language interpreters.
Yes.
Looks like Spanish in this case. So I know on the Trinity Health IJ Medical Group website, we do list additional languages that a provider may speak.
Yes.
That is, I believe, something you can also search on
Mhm.
our website too, so that you could, say a primary care provider speaks Spanish,
Mhm.
and you may be able, if you call and that's your preferred way to
Yep.
communicate is through the phone, then you can ask that question as well. But I know a lot of our providers do speak additional languages, so that's definitely something you could do a little bit of research and find out.
Yes. Yes, and I think, we have a lot of Spanish speaking patients and we always have an interpreter handy. And if there's no in-person interpreter, then I will get a phone interpreter for any patient that comes through that needs one. So yeah, we live in a diverse area, Southeast Michigan. So yeah, we have a lot of interpreters handy.
Okay. Okay, I'm just gonna scroll through and make sure. It looks like
Yeah.
this person was asking specifically about the WHO new class recommendations for severe obesity versus morbid obesity. I'm not sure if you want to address that specifically, or maybe
Mhm.
that's a question that would be
Yeah.
best addressed in a individual appointment.
Yeah, there is. This is a good question. This is really getting into like the nitty-gritty. But I believe, um, and I could be wrong, but obesity is 30 to I want to say 35, and then 35 and above, you're heading into class 3 severe obesity, and then 40 is morbid obesity. That's what I would say. But maybe I'm off a little bit. But yeah, that's what I would say off the top of my head.
Okay, and it sounds like it's such an individual discussion too, because
Yeah.
of so many factors. Absolutely.
Yeah.
Okay. I'm just going to scroll through. So again, you are welcome to take a quick screenshot of the contact information here on the screen, or you can wait for the email to arrive, or you can visit ihacares.com at any point and you can search Dr. Dagher, and as well as other primary care providers. We have a number of practices located across the region in most of the counties here in lower Southeast Michigan. So definitely take a look there if you are looking for a new primary care physician. So if somebody might be new to Trinity Health IHA Medical Group, um, can you talk about maybe like what's the best way to sort of join a new medical group? So I know our My Chart, you can link your My Charts with other medical groups if you have physicians in, different um, hospital systems or things like that. Uh, is that something that should deter people? Or do you think it's a pretty smooth transition?
So, sorry, was your question like,
So no,
sorry.
no, that was a kind of a long one. So
Yeah,
if this is a person's first
yeah,
time having a physician in Trinity Health IHA
sure.
Medical Group, and maybe their other specialists or physicians are part of another health system, is
Okay,
that something
okay.
that should deter them, or do you feel like the connection is pretty seamless at this point?
I think great question. I think the connection is pretty seamless, especially if your other physicians are through offices that use Epic. So Beaumont, we have access to all of their records, and Henry Ford, we have access to all of their records. U of M, we have access to all their records. So yeah, if you're coming from those health systems and you have doctors in those health systems, we can see everything. And then outside, if you're coming from a private practice, if you're coming from maybe Ascension, Providence, or something like that, then we'd have to ask for a release of records. But I think all of the major health systems in the area, it's pretty seamless at this point. I've had patients from all over. So
Perfect. And it's so great to know that you can easily access those
yeah.
test results and all of those pieces of information.
Yeah.
Okay, there's a couple questions left. Are you okay to hang on? We're a little bit after 8 o'clock. Are you okay
Sure, I
for
can hang on.
perfect? Okay, we'll just ask a few more here.
Hmm.
Can you talk about your recommendations around mask wearing? I know we
Yeah,
wear them in the medical practices, but how about when you're out shopping or maybe
yeah.
yeah, doing some of those daily activities?
I think right now, wintertime, I'm 100% advocating for mask wearing while shopping or out in the community. We have flu A out there, we have COVID out there, we have RSV and a variety of different viruses. So I would say, yeah, even if you are vaccinated, I would wear a mask right now. There's just so much out there.
For sure. I know it kind of started with COVID, but it really has helped prevent
It,
so many other
yeah.
illnesses too.
At this point, it's helped me when I'm seeing patients. Knock on wood, I haven't gotten sick yet. Oh my gosh, knock on all the wood, but I'm wearing my mask all the time when I'm seeing patients. And before COVID, back in 2019, 2018, when I wouldn't wear a mask, I would most definitely get sick multiple times in the winter. So
My
it's
gosh.
helped me with everything, not just COVID.
Excellent. Yeah, and I
Yeah.
can definitely attest to that as well.
Yeah.
And then it looks like there's one more question around Metamucil. Is there
Yeah.
um do you have a recommendation or is there a form of Metamucil, maybe a different brand that does not have sugar or a sugar substitute?
That's a good question. And other than Metamucil, I really don't have another brand of it. I'm sure there's other fiber supplements, maybe diabetic friendly fiber supplements out there if it's the sugar substitute that you're concerned about. Um, there's also, yeah, there's definitely other fiber supplements other than Metamucil. So I would look into that for sure. Ask your doctor about that.
Okay. And it looks like one or two more popped in. Do you use spinal manipulation to assist in the healing process?
I do.
Excellent. And you did talk about earlier that you will schedule more frequently than once a year if that's something that will be beneficial to the
Yes.
patients.
Exactly. So if somebody is benefiting from OMT treatment, then I'll bring them back once a month if they want for treatment. So that's how frequently that'll happen if it's helping and people enjoy it.
Yeah, definitely.
Yeah. And it looks like somebody posted the obesity classes. So
Yes.
I'll just read through them. Class 1, somebody said is 30 to 34.9. Class 2 or serious obesity is 35 to 39.9, and then class 3 is 40 and higher. So yeah,
Okay. Yes, perfect. Thank you for helping us along there.
for that. Yeah.
Yeah.
Just really
We-
refining that for us.
Definitely. There's always
Yeah.
a very engaged audience and it's so appreciated.
Yes. It is. It is.
Okay, so I believe we touched on the bulk of the questions. So we'll just say one more time that if you are interested in scheduling with Dr. Dagher, you are accepting new patients.
Yes.
And again, you're located, I think, pretty conveniently on Woodward and Square Lake there if you
Yeah.
live in that region or close enough
Yeah.
to make it convenient for you.
Yeah.
So you can either call, you can visit us online at
Hmm.
ihcacares.com.
Very good.
So
This was great.
yes, thank you so much. It was a wonderful presentation. I learned quite a bit, so I appreciate it so much.
I'm glad. I'm glad people learned something. That makes me happy.
Yes, definitely. And thank you again for staying on some extra minutes here to answer all these questions. We appreciate you.
Oh yeah, anytime. And somebody responded on the sugar-free, gluten-free fiber supplement. So that is in the chat for those of you who want that.
Oh, excellent. Okay, yeah, it looks like she's recommending the sugar-free gummies, the Meyer brand. It looks
Yeah.
like yes.
Yep.
Oh,
Yep.
and then is it
Console
Yes, Console
with a
sugar-free.
K. Yeah.
Perfect. Okay, excellent.
Awesome.
All right. Well, thank you all for participating. And thank you so much, Dr. Dagger, for this
Yes.
awesome presentation.